Would a state board make prescription drugs cheaper or just create another expensive government program? Governor Abigail Spanberger's veto of Virginia's PDAB bill shows that the poor track record of these boards is becoming a real problem. The legislation she vetoed would have created the Prescription Drug Affordability Board, or PDAB. These boards are tasked with reviewing high-cost prescription drugs and potentially setting limits on what pharmacies and providers can pay for and be reimbursed for certain medications. Supporters argue that these price caps can lower costs, but critics say they target the wrong part of the system. The problem is that a UPL doesn't actually control the entire supply chain for medicine. Instead, it caps what pharmacies and providers can pay and be reimbursed. If those reimbursement rates are set too low, pharmacies could lose money dispensing medications, and that would reduce patient access. Since the first PDAB launched in 2019, only 3 UPLs have been set, and in that time, PDABs across 6 states have cost taxpayers more than $28 million. Maryland's board took more than 5 years to approve their first upper payment limit. And before doing so, the board chair admitted, "We have accomplished basically nothing. The return on investment is terrible at this point in time." In the months since passing the nation's first UPL, Colorado's PDAB has faced leadership turnover, canceled meetings, and costly ongoing litigation over whether the caps are even constitutional. Governor Spanberger pointed to all of that and said the track record is terrible when vetoing Virginia's proposal calling PDABs expensive undertakings that other states have either repealed or are considering repealing due to costs and ineffectiveness. Virginia's board was projected to cost the state a staggering $41 million through 2031. It's also worth pointing out that the governor asked the legislature to consider several modifications to the plan that would have made the project cheaper, including having the state study a reference-based pricing system and giving the Attorney General greater authority to investigate anti-competitive behavior between manufacturers and insurance carriers. Every single one of Governor Spanberger's reasonable requests was refused by the legislature. Who isn't covered by these price cap proposals? Pharmacy benefit managers, the middlemen of our healthcare system. When drugs are cheap, they've been caught inflating the price, under-reimbursing pharmacies, and limiting access by patients because cheap drugs don't make them any money. We've documented how they fleece insured entities and patients in our handout on our website. While the debate over prescription drug affordability continues, Virginia has for now decided not to invest millions in a questionable model that many argue has yet to prove it can deliver results for patients. To learn more about these boards, visit our website, safemedicines.org.